Hello, everyone. My name is Dawsyn Smith, and I'm a second-year medical student at OSU-CHS at Cherokee Nation. Today, I'm excited to share with you the findings of our research project titled Sociodemographic Disparities in Diabetic Eye Disease, an analysis of the 2021 Behavioral Risk Factor Surveillance System. Diabetic retinopathy, a common eye disease associated with diabetes mellitus, is the fifth most common cause of preventable blindness worldwide. In 2021 alone, there was an estimated 9.3 million people in the United States that were living with diabetic retinopathy, and this number is expected to double by the year 2050. In the past, research has shown that certain sociodemographic factors are linked to diabetic retinopathy, amongst other adverse health outcomes. Our objective in the study was clear, and we wanted to examine the disparities in the diagnosis of diabetic retinopathy among various sociodemographic factors in the United States. And we did this using BERFIS, which is a large nationally representative data set. As for the methodology, we conducted a cross-sectional analysis extracting data looking at sociodemographic variables such as sex, race and ethnicity, income, educational attainment, insurance, county rurality, and metropolitan status. The test we did was chi-square test, which were then used to determine the associations between diabetic eye disease and these sociodemographic variables. As for our results, from our sample of 21,905 participants, when we observed the rates of diabetic eye disease based off sex, we found that the lowest prevalence was in females, with the highest rate observed in transgender participants. When looking at race and ethnicity, we found that white individuals had the lowest prevalence. And we also saw that the prevalence was inversely associated with income and educational attainment. Interestingly, differences in the prevalence of diabetic retinopathy or diabetic eye disease based off rurality and insurance status were not statistically significant. So what do these results mean for us? We think that tailored interventions are imperative to tackle higher rates of diabetic eye disease in specific demographics. And one way we can do this is through initiatives like medical financial partnerships within clinics that can offer not only financial guidance, but also education to dismantle barriers that prevent people from accessing care. Another implication is community-based health literacy campaigns that stress the importance of regular eye exams and diabetes management. Lastly, incorporating training within clinics to educate and reduce bias could help foster the patient-physician relationships and address some of the perceived stigma experienced by marginalized communities. In conclusion, our findings reveal that disparities in diabetic eye disease based on sex, race and ethnicity, income, and educational attainment. It's important to note that there's no singular solution, but rather to address these disparities, it will require a multifaceted approach that combines targeted interventions, community engagement, and a broader societal commitment to healthcare equity. And by acknowledging these disparities, we can work towards a comprehensive strategy that fosters inclusivity, accessibility, and ultimately improves some of the measures that can prevent this prevalent and potentially debilitating condition. I hope you enjoyed this presentation, and I thank you for your attention.